Hi everyone, I am Nikhil Panse and welcome to this session of Candid Conversations. So what happens in these sessions is that these are purely non-academic discussions wherein we try to have conversation with leaders, pioneers, innovators in our field, people those who have taken the path which is less traveled, and we try to interview them, gain insights from them, and obviously learn from them. So in this session of Candid Conversations, we have with us everybody's favorite teacher, GK sir. We have Dr. G. Karthikeyan. He is the president-elect of Indian Society of Surgery of Hand. He is the executive member of Association of Plastic Surgeons of India. He has recently retired as professor and head of plastic surgery from the super specialty hospital at Chennai in 2024. As we all know, he's a very passionate teacher. He's well known for his YouTube channel GK Hand Surgery, which we all tend to see very often before surgeries, after surgeries, during revisions. He has over 45,000 subscribers, which I believe is one of the maximum number of subscription for any purely academic plastic surgery channel. Over 500 videos are there with over 3.5 million views, and he is very regular in his update of videos, which is roughly around 2 video updates every week. So welcome sir to this session of Candid Conversations.
Thank you, Nikhil. It's great to be on your show. And I'm looking forward to a lot of interesting information and exchange of information between both of us.
Absolutely, sir. Delighted to have you. We have been talking informally for quite a long time now. I just wanted to, because wanted to have certain insights from you. I running a channel myself, so it's good to have you, sir.
Thank you. Thank you so much, Nikhil.
So you have been a teacher for over 30 years, and I would say a very passionate teacher at that. With the increasing number of seats in the plastic surgery training across India, what do you think is the quality of education that we are imparting to these students? Are we keeping in tune with the increasing expansion of these seats? Because now every MCH curriculum has got 8 seats, 10 seats. So what are your thoughts about that?
Basically, Nikhil, what I feel is by increasing the number of seats, logistically, what happens is the number of cases that each postgraduate gets exposed to or does or assists goes down. I am not saying that every postgraduate must do 100 cases to understand the surgery. Even a single case, if done properly with correct guidance and the correct teacher guiding them, that is enough for them to understand that problem. The number of cases has come down. But the second point that I was telling you about was the guidance that should be given. I feel personally that the more the number of postgraduates there are in a unit, I mean, if you have, say, 8 or 10 postgraduates per year, imagine it's going to be 30 postgraduates at any point of time or 24 postgraduates at any point of time. I feel that the personal attention of the teacher for the student is going to come down. Now, it is not an LKG school classroom where you need personal attention of the teacher.
Right.
But I feel in certain aspects, this personal touch is very important. I'll give you examples.
Yeah.
For instance, the logbook. I feel that the logbook must be checked by the professor or the person in charge almost every week. And if that is done, it is going to be 24 logbooks to be checked every week by a person or whoever.
Yes.
And if done meticulously, it's going to be a humongous task. Secondly, in case presentations, when they're doing case presentations, remember 8 postgraduates per year. Just let us assume that only 1 year postgraduate is allowed to present.
Yes.
You will have 8 postgraduates presenting in turn. Or you will say 3 postgraduates present this week, in which case it's going to get diluted again. Because if you're going to have 1 postgraduate presenting the entire case, it is going to be a better exposure. And if that is going to be done, it is going to run for 8 weeks before the next turn comes.
Right.
So the exposure of the postgraduate to the clinical presentation also comes down. The third point is the surgery and the what is known as the theory knowledge.
Hands-on.
Hands-on. The hands-on, it is not possible. It is possible for the professor to help, and because I remember when I was a general surgery postgraduate, my professor taught me the first hernia repair. He personally took interest. He told me to do it, and he assisted me. He was a very senior surgeon. I
Right.
still remember that hernia repair. That is how I believe it is for every postgraduate. When their professor teaches them, they remember it. Because the person who is teaching them is not just showing the steps. He's going to show tips and tricks in doing that procedure, how to get around the problem, everything. So that I feel the postgraduates may be missing. So
Yes.
your question about are we catching up? I don't know. I think we are catching up. But the problem is, we have to take that extra effort as teachers. In those days, it used to be teacher-centric. Now it is student-centric. Nowadays, so you have to prepare questions, MCQ questions. If you have to prepare, you must make 4 answers that are not absurd. They should be similar and they should be in alphabetical order just for one question. And all the student has to do is tick.
Yes.
There, it is more effort is required on the part of the teacher. So that's what I feel, that with this expansion, the work becomes more for the teachers.
Right. I get that. And apart from that, sir, this is about the hands-on per se. Apart from that, what are the biggest gaps you see when you were a resident and the current state of scenario
Yeah,
in the teaching learning process? I mean,
yeah, correct. I'll tell you what I feel about it is that the gap that I see, the first gap that I see is that the range of cases. As far as I know, no single hospital, teaching hospital, does all type of cases.
absolutely.
There may be done, it may be done 1 or 2, but not enough to teach a student. So the only way to get out of this is for circulation. And that is, they must go for peripheral postings. The
Yes.
postgraduates must go to a high volume center or where a lot of cases are done, so that they can learn from the experts. See, I can say, I do cleft lip and palate. Why should I send my student to a cleft lip and palate center or where smile train is being conducted? See, it's not like that. It's not like you. It's not a statement against the teacher. It is a statement for the student to learn better. So it's not that I don't, but I do only 1 case in a year or so, or I do 2 cases in a year. Whereas if he goes to a high volume center where 10 cases are done every week, imagine the amount of knowledge he will gain and the amount of skills that the student can gain. That is one gap, I think. And I know the solution. I just told you the solution also, which is entirely doable. It is only the mindset of the teacher, and every teacher who feels that his student must excel will do it. I know that. The second thing which is not taught in books and all that is the follow-up. Surgery, we have been, plastic surgery generally, we have been taught that what you see on the operating table after finishing the suturing is not what it's going to be after 6 months or 6 years.
Yes.
And generally, the student cannot stay for that long. Student is going to stay for a maximum of 3 years. So he may not see the case that he has operated at the end of 6 years. It's not possible. He may, at maximum, he may see it at the end of 1 year or so. But to help this, I feel that there must be a department database. Okay.
Yes.
So the department database, so today a patient comes, brachial plexus surgery done 5 years back, and he comes today, and you look at it, you do not know how it was those days. So when you go to the database and look at it, you give his ID number or whatever and look at it, the student is able to learn. And when the student sees this preoperative or the first picture or the video along with the teacher, it is a wealth of information. Because after 5 years, what procedure has been done? Look at the result now. Results are there to be seen.
Yes.
It's a wonderful way of learning. The follow-up. This follow-up also, I feel, Nikhil, is something that is a gap. And the third gap I feel is the research. And by research, I don't see nowadays they have, for instance, in our university, Tamil Nadu MGR University, we do not have a thesis because the basic idea is that they have already done a thesis when they did their general surgery or specialization. There is no need to do another thesis, but they have to publish.
Yes.
To publish a paper, and that is important. But I feel that they do it just for fulfilling
Sake
the
of doing it.
yeah, for the sake of being able to write the exam. But just look at the number of postgraduates you have and the number of publications or the number of papers being presented at conferences. It is much less. They may do it just for the sake, as you said, for the sake of exam purposes.
Yeah.
I think it should be encouraged. I mean, when I was in my early years, even as a consultant, I always felt, no, we are operating. We don't have time for publications. We don't have time for research. Now I have realized that it is so important to do research. Today, if I want to get an information across to my student across the table, I must show it to him in black and white.
Yes.
In those days, our professors used to say, my professor did this, I do this, this is how you must do it. And I would accept it. And I would accept it. But today the student is not going to accept it. Where is the evidence, he will ask. So
Right.
the period of residency, the 3 years, is a wonderful period where you can think about it. Youngsters are absolutely intelligent. Everybody knows that the youngsters are much more intelligent than what we were at that age. Do you agree, Nikhil?
Absolutely. Absolutely.
Yeah. So now they have that much of intelligence. So it is up to us to guide them into the right path. Somebody has said, no, that residents are like missiles. They will go wherever they are aimed. Up to the teacher or the guide to aim them in the direction towards progress. So these three gaps, that is the research, and then the follow-up of patients, and then the range of cases that are coming that they see. These three are small gaps, and I've also told you how it can be corrected.
Yes. Sir, a common concern is also decline in hands-on training opportunities. Since the number of seats have gone up, the hands-on for each individual resident has definitely gone down, which definitely in turns affect the surgical expertise. If you are going to do more cases, obviously you are going to be more and more pro at it. How do you think we can address this critical issue of hands-on? And do you think surgical videos can help bridge this gap, especially when we have a resource limited environment? Not many cases. One case is shared by maybe 5-6 residents.
Yeah. Now that's a very good question, because how important are these online videos for training? Can
Yes.
they sort of supplement? So basically, I feel, Nikhil, that they should have a basic concept. The basic concept should be good. For instance, I'll give you an example. They should be able to suture the skin well. I know it's going to be very basic. They should be able to suture the skin well. They should be able to handle the tissues correctly. They must know how the bone should be handled, how the nerve should be handled, how the vessel should be handled. And they must know the basic process of decision making. As you know, as surgical teachers, we are not aiming to make them surgical technicians. We want to make them good surgeons, in which case their skill set must come starting from decision making. The decision, it's actually very simple. If somebody told me, do this procedure, it would be so simple for me. I would do the procedure, I'm very happy. But the whole problem is what procedure to be done. That is the question. And these students must be taught that. And most importantly, after all these skill sets of skin suturing and then the tissue handling and decision making, more importantly, how do they do a dressing? Very simple. But how do they do a dressing? How do they put the POP? Do they relegate the POP to the nursing assistant there and they walk out? Or do they stay with the patient? They stay till the POP is set. Very simple. This sounds too simple.
Yeah.
But these are things that the residents must learn. Once they learn all this, they can go to any video and do any surgery. But the basic concepts, the teachers in their place must teach them. That is enough. After that, the students can pick up. See, it's like teaching ABC. The nursery school teachers taught us ABC. We picked up all the words after that. But that ABC must be very sound, isn't it?
Then language can be created by individuals.
Yes.
Like Javed Akhtar said, the more the words you know, the better will be your content.
Yeah, will be your content. Very true. Very true.
So, sir, technology has, as we all know, has clearly transformed medical education. So, from your perspective, is this trend towards I would say digital education, is it better? Is it bad? Because what happens these days is not well-trained plastic surgeons or maybe surgeons from other specialties tend to look at the operative videos on YouTube and they tend to do procedures. So I'm not sure whether they are actually qualified enough to see those videos and actually do it. But what are your thoughts about it? Is this trend towards digitalization, providing content online, is this good, or are we not taking the right step?
Yeah, we were just speaking about the resident who is taught the basic concepts correctly, and then I said he can go and do any video, any procedure that is online. But there are a lot of people out there who want to do the procedure who do not have proper grounding in the basics. That is when the issues arise. Okay. Now, let us agree on one point. Online teaching is here to stay. What happened during COVID was it was catapulted, it was fast forwarded by 10 years. If COVID had not come, we would have still been in a small, very remote place where you would have an online teaching or meeting going on. But that COVID has totally changed it and fast forwarded.
Absolutely.
So now, having agreed that online teaching is here to stay, we need to teach the students what to take and what not to take. For instance, I see a video on YouTube or some other media. Shall I go and do the procedure? The most important thing is, excuse me, 1 minute.
Yes, sir.
Yeah, sorry. So the most important thing is that now in Tirukural, there is a old Tamil literature called the Tirukural, and a saint poet called Thiruvalluvar is supposed to have written it. He says he's written about 3,000 or 1,330 small couplets.
Yeah.
It is 2 lines, and he sort of brings so much of wealth of information into it. I'll tell you what this couplet means. Epporul yar yar vai ketpinum apporul meipporul kaanbadu arivu. What it means is, whatever you hear, wherever you hear it from, first analyze who it comes from and then you apply it or take it into your brain. Otherwise, it's just standing out there. So whatever you see, okay, how do I know? I'm watching a video. How do I know whether it is authentic or not?
Yes.
The first thing is, who is the speaker? And what are his credentials? What are his or her credentials? And about the video, is it of good quality? Is it evidence-based? So all these things must be taken into account. Now, we are dealing with doctors. They are the cream of society. And definitely they have some basic intelligence.
Yes.
Sometimes we tend to forget that intelligence, we behave like we don't have any intelligence. but we are basically intelligent. I know this is a little controversial. Yes, but we are the cream of society. So here we need to understand what is it that is being taught on the video. Is it good? Is it right? Or is it wrong? So that way, if it is used that way, it is a wonderful medium for learning. Like everything in the world, fire is so useful, but still so many accidents happen. So many
Yes.
problems can occur.
Yeah.
That does not mean we have to condemn fire. It is because it's not being used properly. So
Right.
the online medium is like fire. It can teach you wonderful things. It can also totally mar your career if you learn from the wrong sources. So that way, online media are very good sources of information. I think it is good, but we need to be very careful when choosing who to learn from or which medium to learn from.
Right. That was a very precise and specific point. We need to be sure of the credentials what we are watching on. So, sir, you have been absolutely a pioneer in creating high quality academic content online, especially related to plastic surgery. Now, you have also started those motivational Monday videos and 1 minute shorts, which are extremely, I would say, catchy and make you want to see them, and they simply go into your memory. So, what inspired you to begin this journey? Because if we see around, there are not many people who have ventured into this field
Yeah,
of
correct.
online teaching as super specialists.
Yeah. Actually, Nikhil, to be honest, about 6 or 7 years ago, I was looking around and saw some videos. And actually, your video, you are actually, I think, yeah, you are the first guy who sort of inspired me.
So, is
Because,
it?
look at this guy, he's making videos. And I just went through one or two. I said, I think one day I'll also make videos like this. So, Nikhil Panse was my first inspiration.
Oh, that's wonderful.
Yeah. And then what happened? Following up on this, what I did was, I think it was in 2017 or 18, I'm not too sure. We had a CME and we had a hands-on workshop where we did biogeometry of local flaps.
Okay.
And so we took a video of all these. And just one Sunday, I was just sitting alone and I said, let us make a YouTube channel for our department. That was in Kilpauk Medical College when I was there. And I uploaded the video. I mean, I was just learning too. And I said, it seemed to be quite easy. I uploaded the video.
Right.
I totally forgot about it. Almost 1.5 years later, I was going through something else. I usually listen to old Hindi songs, old Tamil movie songs and all that. Suddenly this came up. I said, oh my God, this I have uploaded. And I saw that it had about 10,000 views. That sort of was a revelation now. 10,000 views, a video that I have uploaded. Oh, this is wonderful. So then what happened? I was just waiting for an opportunity. I didn't have the drive to start. Then my good friend, Professor Jagan Mohan, who was conducting the regional state plastic surgery conference, he asked me if I could moderate a session on brachial plexus injuries, adult brachial plexus injuries. It struck me suddenly, sir, I'll do that. But what happens is when you get all experts to talk about brachial plexus injuries, they assume that you know everything and they talk about this nerve transfer, that nerve transfer. Because that is how it was when I was studying. I just understand what they were talking about. We had professor and our senior assistant professor, Dr. G. Balakrishnan and Dr. Krishnamurthy. During rounds, they would talk about I think we should do this nerve transfer. No, I think we should do. What are they talking about? I couldn't understand at all. So then I told Professor Jagan Mohan, sir, I'll do it. But before that, I'll start a YouTube channel. I'll run a series on brachial plexus. And I'll put it up free on all our groups so that all the residents will be aware of the basics. And the final meeting will be at your conference. So it will be a sort of the end session of the whole series. So I put up around 12, 13 videos, like for instance, clinical examination, anatomy, then clinical examination, then what about upper brachial plexus, how to plan it, and the lower plexus, how to plan, palsy, how to plan, all that I made. And then surgical procedures, like for instance, Oberlin transfer. How is it done? What are the indications? All that I did. And it was received very well.
Very
And
well.
at the main conference, people could understand what was going on. So I felt that was interesting. And then at the conference, people asked me, now that the conference is over, what are you planning to do to your YouTube? I said, I think I'll continue it. So then I had to start thinking of continuing this procedure, because mainly, the important thing is it is free.
Yes.
You don't have to spend money, or we
Yes,
don't
for
have to
doing it.
spend it. There is it's no financial thing involved here.
Yeah.
Just have to sit and do it. That's all. And I also noticed one thing, that as you keep doing it, you learn a lot of new things.
Absolutely.
That is what sort of kept me going at it. And then, it becomes a sort of, and that day I said, look, I'm going to make it a deadline. I'll publish it every Sunday. And that time it was only one video per week, every Sunday at 6 a.m. So that was an important thing, because generally, we are all very lazy. We have to accept that.
Yeah.
Because to get us out of inertia needs a great force to get us out of inertia. And one of the forces that I feel is quite great is a deadline. You have to pay your taxes before July 15th. Nothing will be done till July 10th. Then you go and run for the accounts and all that, send it to your auditor and all that. So that is what happens, deadlines. So I set a deadline for myself. That was the thing that kept me. See, nobody is going to ask, if I don't publish a video on one particular Sunday, nobody's going to take a phone. Why didn't you publish today? Nobody's going to.
Right.
But I'm going to ask myself. I know that I have not published. So that would sort of make me feel so guilty, So to avoid that, I started this. So that is how the YouTube sort of grew.
But that is really very interesting, sir, because I recollect your brachial plexus series like it was yesterday, and the time has flown so fast that from a couple of hundred subscribers you have gone to 45,000 plus subscribers. I believe that is a phenomenal number for a channel which has got a very focused and niche audience. Not many people are going to come and see these videos. So in spite of that, and you have a global following. So that is, I think, also what makes this platform unique, that whatever efforts you have been putting in is not only useful for our residents, but for trainees across the globe. No, sir, coming or taking this point forward, now many residents these days rely on the short form of videos, maybe 5-minute videos, 10-minute videos, and your 1-minute shorts are also very catchy. And they tend to skip reading textbooks and journals. Do you think this is a good way to go forward? Does it need balancing? And how do we do that actually? How do we create a balance?
Yeah, that's a very good question. Now, the thing is, every time I meet students, I meet residents, when I meet them at conferences, I always give, I think I should put a statutory warning in I think all of us should do that. No, statutory warning. Do not do the procedure following this video alone. This is an adjunct to your studies.
Yes.
And I don't know if you have got that sort of comment, that the professors are very unhappy with your videos, because whenever they say something, no, this video says it's like this. They have said that. Now, that is one thing, yes. Now, supposing I was a teacher going to teach my student, and he says, no, Dr. Nikhil Panse has said this in his video. I'll follow only that. So the thing is, whatever it is, now the source is good. Dr. Nikhil Panse is a good surgeon. He is a good teacher. And what he says might be correct. So if I am going to contradict that, I must have enough information with me to be able to tell the student why that may not be correct. So it must become a scientific discussion. I want
Yes.
to raise the level of all the professors so that they can go above my videos and discuss with the students. So then what happens? The students, I told you, are very discerning. They know that this video is good. But then when their teacher tells one or two points, they will fall for their teacher rather than the video, because face-to-face interaction is much better. So I feel that the videos are to be taken only as an adjunct to the teaching that is going on in the hospital, as an adjunct to the learning that goes on in their home or in the library. All these must be done. Only then the YouTube videos. As you said, the shorts. The shorts actually are supposed to be quick when you're learning in the exams, no? When you're learning for the exams. Suddenly you've forgotten what are the branches of the median now. Okay, look at this short which says what are the branches of the median in 1 minute. They don't have time. The students, I don't know what they do, they don't have time at all. So this is a quick way of, actually, it's a very humorous incident where I asked one of the residents about, tell me the branches of the median now. So he just looked around, in the arm, he started. I said, look, I made a video of 20 minutes. You would not listen. Then I felt you were too busy, so I made a video for 10 minutes. We called the Must Know series. You did not see that also. Then I said, oh, this fellow is very busy, so I'll make it for 1 minute. That if you don't see, what should I do? So that way, the books and the teaching at home are, and the teaching at school, at medical school are very important. Videos are to back up your information, back up what you have learned. And if something is wrong in this, they are always welcome to go and tell their professor or teacher, sir, he says like this. Do you think it is correct? So there begins positive learning.
Absolutely. It is all about constructive criticism and taking that forward.
Correct. Correct.
Coming to the shorts, sir, your 1 minute shorts, I think they are very catchy. People tend to remember what you have mentioned in those shorts because of your lucid way of presentation, because of your use of animations.
Yeah.
I actually don't remember my videos, but I tend to remember what you have said in your videos. How does the serratus work and how does the palsio occur and all those things. So in the process of your video making, what do you think is the most critical part of it? Is it the actual content? Is it the animation? Is it the voiceover? Because getting all these things in a minute and making it effective, making people remember it for a prolonged duration. So I believe there is something more to it. So what do you feel is the most important ingredient of it?
Actually, a few years back, one of my colleagues asked me, what makes you make a video every week? So I said, look, basically, I don't understand things very, very quickly. I have to sit and think about it, only then I understand. But when I understand something, I want to tell the world. I'm so happy that I've understood this point. That is what is the basis of the short videos. And if you ask me, the most important thing is the content. What to talk about. That is so important. What to talk. Sometimes, I don't have any, it suddenly flashes. So yesterday there was this thing about, we had a bone grafting and we were talking about the types of bone healing. So shall we make a minute? Now, making it in a minute, sometimes, usually it goes beyond a minute.
Yes.
So I have to prune it. I have to edit it and make it 1 minute. So I have to remove anything, any word, any letter that seems a little superfluous and not needed. It is like making it an essence of juice or something. The juice is the 20-minute videos that we all make. Or you make about 8 to 10-minute videos. Right. So this is the next concentrate. And this is an essence. It's a small, just 1 teaspoon, and it's very concentrated.
Mm-hmm.
And the editing work is a little difficult, but technically, Nikhil, the software that is available on our computers, whether it's Mac or whether it is a Windows, it is all inbuilt the software, and it's quite easy to do it.
Yeah.
The
Yeah.
only thing that it requires, no payment, nothing. The only thing it requires for you to spend a few minutes or a few hours
Efforts are required.
and get used to it. Once that happens, it becomes a way of life. But everybody says, no, no, that's very complicated. Not at all. If I can understand it, anybody can understand it. That's what I tell everybody.
Right, right. But sir, don't you think this few minutes have come down drastically since you initially began editing those videos? It must have taken you quite some time. Now that you have become a pro, you are taking less and less amount of time. But coming to what I wanted to know next is how much time does it typically take to make one particular video for you? Because I think doing a 1 minute short takes a lot of efforts. You have to go through that literature. You have to sort of zero down on what essential content is. You have to bring all that 10-15 minutes of data into 1 minute and do it. So can you take us through this thought process of your creating shorts as well as other videos from the initial idea to the actual execution of it?
Yeah, the videos actually, once I have thought of an idea, okay, let us do a video on, say, nerve transfers in the hand, in the upper limb. Okay, once I've decided on that, now all my videos are based on PowerPoint presentations.
Yes.
Every single video of mine starts with a PowerPoint presentation because I'm comfortable with PowerPoint. So
Right.
I don't make the PowerPoint immediately. So this week, for instance, today is Monday. Let us decide that this Sunday, I'm going to put up a video on nerve transfers in the upper limb. So now I'll start reading. I'll start reading books and I'll get information and I'll immediately put it into the slide. I'll type it into the slide. Once I have done, I keep doing that. Suddenly I find a website which has got good information about nerve transfers or some good picture. I'll take that and put it into the slide. So by around, say, Wednesday or Thursday, I just go through those. I find a lot of them are not useful, may not be useful because it doesn't fit into the flow of my video.
Yeah, and into the 1 minute.
Yeah, correct. So what I need to do is ruthlessly throw them out. Sometimes, I remember in those days when we used to take pictures, prints of photographs of cases. No? At the end of the year, you will have about 100 cases, pictures, photos, prints, for which there was no pre-op. Sometimes you will have good pre-op, no post-op. Sometimes you will have the intro picture, no pre-op, post-op. But still we keep retaining those pictures. They are of absolute no use. There was one assistant professor called Dr. Sampath Kumar. He said, just give it to me, I'll have a look. He took it, tore everything and threw it into the dustbin. He said, this is the biggest help I've done for you. So now you are clutter-free. Now you can start accumulating good pictures. That is the important thing. So I take away all those that I don't need. Then I have to arrange the order in which it is. It must go like a story, It must go in a flow. As my professor, Dr. Balakrishnan used to say, it must go in a flow. That's what he would say. Any presentation, any talk must go in a flow. That flow I maintain. And there need pictures. I may have pictures. Sometimes I don't have pictures. I may not have done the procedure. But I'm aware of how it is done and all that, but I don't have pictures. So I take from the net. I make sure that when I take a picture from the net, I give the picture credit below.
Yes.
Because that is very important. The
Absolutely.
second, yeah. And sometimes when you need to explain concepts, I feel that drawing is much better. And PowerPoint is wonderful for that because you can draw on PowerPoint and you can make it replay that the sequence in which you drew. So that is very simple. So all my videos are based on PowerPoint. So by Saturday evening, my PowerPoint will be ready. Now what I do, I take a screenshot of every slide.
Okay.
And I put it into the movie maker, whatever it is. If it is Windows, it is movie maker, or it is Mac, it is iMovie. I arrange all of them in order. It will get arranged in order when you put
automatically. Yeah.
Yes. And each will have a timing of 4 seconds. That is automatic. It is the setting, video setting. I make them all 20 seconds. I make them all So that slide will run, that particular slide photograph will run for 20 seconds.
Okay.
Will start my editing. I'm sorry, narration. So there is no sound at all now. Now I'll take up my mic. I use a lapel mic which I got for 300 rupees. That is
Okay.
my only, I think that's my only investment. So I attach, but the mic is important for the good quality of sound.
Yes.
And then I attach that mic and I start talking. When I talk, sometimes I'll stop in the middle because I do not know what is next. That doesn't matter. I'll keep talking, then I'll go to the next slide, then I'll keep talking. Then finally, I'll go back to that slide where it needed only about 10 seconds of talk, whereas the slide runs for 20 seconds. So
Yes.
the remaining 10 seconds, I'll just cut and throw it off, edit.
Oh.
So it will look like as if it's a very seamless talk that I'm giving. It is actually edited. I do the editing. So it's very simple. And this I do morning 2 o'clock.
Yes, that I am totally aware of now that we have interacted so many
Yeah.
times.
Yeah. So because that time is so quiet, there are absolutely no disturbance. And you can just go ahead. There's no disturbance, so you can keep cutting and editing because this is some work that we're not used to do, this editing. I mean, in the beginning, I was not so used to it. So I don't want any disturbance. So I used to do it. And by about 5 o'clock in the morning, it is all ready. So what I do, that video, I convert it into a video.
Yeah.
And then I upload it on my YouTube channel. And this is, it involves a lot of learning. For
Yes.
instance, my professor, Dr. Nirmala Subramaniam, you might have heard of the name.
Absolutely.
Yeah, she is wonderful in oculoplastic surgery.
Yes.
He called me about a month back and said, Karthikeyan, can you come over to my house and teach me how to upload videos on YouTube? She is 83.
Yes.
So there is no age for learning. Everybody can do it. Everybody should do it.
Right.
Because all of us know something that the other person does not know. What you are doing may be very common for you. I mean, I do this often. What's the big thing about it? No, there are others out there who are not as fortunate as you to see those cases. So if you teach them, everybody can keep going up. That's the important part. So everybody, I feel, must go. It's not a big thing. Everybody makes a PowerPoint. All you have to do is take one more step and go forward into the video.
Right. So one rapid fire question: how much time does it take you to create 1 minute short?
1 minute short. It takes about 3 days for me to think up an idea, and then it takes me about 3 hours.
Oh, that's
3
a
hours.
phenomenal amount of time. Definitely. And many people think, including myself to some extent, I used to feel that creating this videos, which obviously when you look at those videos, you feel that it is just a 1 minute short. But creating videos to some extent myself as well, I know how much time and efforts it takes to create a very short video as such. So don't you think it is a thankless job, especially when there are no finances involved in it? What are many people feel that it is a thankless job, especially when it is not monetized. And
Yes.
without that, what keeps you going, putting in all those efforts, putting in 3 hours to make just a 1 minute short?
Yeah. Okay. Now that's very interesting. I would divide the answer for this question into 2 parts. The first part is about the first 1.5 years of my YouTube exploration.
Mhm.
In those days, what I used to do was I used to make a video and I did it for the sole purpose of enjoying what I'm doing and telling people what I know or what I have learned. It may not be what I know. For a lot of things that I had to relearn. I thought it was that way, but when you go in to prepare a video, you read a lot of books and you
Yes.
realize that what you thought so far is not true. So I learned a lot of things. So then, by the time I had made my video, I had got back my what do you say, the riches of learning.
Yes.
So that I felt. I mean, I felt it was something like a business where you get the profits even before the product is released. You know, like these movies, they always depend on that first day. the opening market or opening box office or something they say. Sometimes it is so big that it covers all the cost of the making of the movie. After that, whatever comes is just additional bonus for them. So that way, making the video was what I wanted to do, and I did it. Actually, one of my colleagues asked me when it reached about 1,000 subscribers. He asked me, "What is your goal this year? 10,000 subscribers?" I said, "No, that's not my goal. My goal is to make another 20 videos." That's
Yes.
all. I was doing it just for the fun of it, just for the heck of it, and just for learning. No, you learn from all those. Next came, I told you this is the first part of the answer where you were doing it just for the knowledge. Second, let me make a revelation. It does pay. It does pay. So that it pays after a certain number of subscribers. You need to have so many subscribers, and then you need to have so many watch hours. So people must have watched it for so many hours. So then they consider your videos for monetization.
Yes.
So you have to apply to the YouTube, whatever, to say, give your bank details, and then they pay you $100 for. I mean, when it comes to $100, they send
You were paid. Yeah.
money to you. And what I have been making for the last, say, three and a half years is around 3,500 rupees per month.
Oh.
It's 3,500 rupees per month, which looks like a pittance. Now there are a lot of cookery channels and gardening channels that make crores of rupees per month.
They have a huge audience. Our audience is very limited and restricted.
So as I said, the pleasure I have already got by making the video. Now, whatever I get in the form of money is only an additional, it's a bonus for me. And the best part of it is that you're going to send, you're getting the money from United States.
Yes.
And they will send you a tax statement every year. This year, this much of tax has been deducted. They deduct at source, no? So they tell me all that also. So I tell everybody, look, I'm a US tax assessee. So be careful when you talk to me. So that way. But the thing is, the monetization comes from the people who see your videos. More number of people, if they see it in India, the amount of money I get is less. The people who see it, if more number of people see it in the US, the amount of money coming in is more. And the duration, for instance, if people watch my video, 20-minute video for about 3 minutes and then they just scroll off, only for those 3 minutes it will be monetized.
Yes.
So as I said, it's an additional bonus. So I'm not at all worried about that. And sometimes surprisingly, some video that you did not expect to do well suddenly becomes viral. Everybody sees it and makes comments and all that. Sometimes you would have spent so much energy and learning for a particular video, very few people watch it. So it's like I always compare that to a movie director. No? I know some very good movie directors who make a movie with all their soul and heart and soul into it, and it fails at the box office. Whereas they make some other movie and it hits and it becomes a hit, even though it doesn't have the same sort of the drama or the depth that the other movies had. That is life. That is life. You just learn to enjoy it. No?
Yes. And as you said, the maximum gain is by the teacher who makes those videos.
Yes.
Because we have put in a lot of efforts. We have read through multiple books to create that content. Yes. And the viewer might not even look completely for those 10 minutes or so. But to create those videos, we have put in 2, 3, 4 hours of work and read from all possible sources, made sure that nothing is wrong. So I believe that is also one of the important advantages, that we become well read. We know that what we are saying is evidence based and what is as per the current literature standards.
Yes, you're right. You're right.
So, sir, coming to the next question now, you have been doing this consistently for more than a couple of years. To do this for a couple of months is okay, one video per 2 weeks, 3 weeks. What keeps you motivated and disciplined to do this year after year now? It's been many years now that you have been doing this. with a consistent schedule of posting videos?
Yeah, I think that's the answer to your question lies in your question itself. The consistency at this particular time, 6 a.m. on Sunday, a video will be released. You should imagine the amount of stress I go through on Saturday nights. I don't go out for dinner and wife will call me. No, I have got a video to make. I have to make it. So only when I'm through with it, I get relaxed. So it becomes sort of, I don't know, maybe it's an obsession. It becomes an obsession sort of.
Yeah.
But I feel that consistency is one of the most important the things needed for
Right.
success. This I realized after I started doing all this, consistently put a video every week, and now it's going to be almost in another 2 months. It will be completing 6 years.
Yes.
So,
Phenomenal.
so this is, I mean, the content. If I were to rate my content, I would say it's average content. But as you said, not many people are are coming into this sort of what do you call as genre, where you teach,
Yeah.
where you teach, like you make a PowerPoint and you teach them what is this, what is that, and there are not many people. And the second is the consistency. Every Sunday morning, you can expect to learn something new. As a matter of fact, when people call me to present at conferences, I'll say, "You have seen enough of my face. Every Sunday morning, I come and wake you up. So you still want to see my face in the conference," I tell them. So the thing is, uh, the thing is consistency, and sometimes you have to drive yourself. Sometimes, I said I wake up at 2 o'clock. Sometimes I may be sleepy. There may be days when I don't feel like waking up at 2 o'clock.
Right.
I have to. So I drag myself out of bed and sit, wash my face, sit down. And then when you get into it, it just keeps going. It is that starting trouble, Nikhil. That is the thing that everybody has got, that starting trouble. No? So that's what I say. If you want to write a thesis or a book, don't write one chapter. Just write one line today. Just write one line. Tomorrow, write one line. You'll see how it builds up. And that's what I said, breaking that inertia. Once you've broken that inertia, it always goes smoothly.
Right. And I think, sir, one of the other important things is, since you have put it in public domain, you have already declared that you will be posting one video on Sunday at 6 a.m. So it becomes a sort of a commitment to your own self.
Yes.
So that also, since you have committed on a public forum that
Yeah.
you are going to do this particular thing at this particular time, then it is my responsibility now that I have committed. I have to follow it through.
The worst taskmaster, myself. So
Yes.
that's the problem, no? So I cannot face myself. I can face anybody else if they ask me, but I cannot face myself.
Right. So you have a massive fan following in the plastic surgery fraternity, including myself. Whenever we meet, I ask you a couple of questions about how you have created this particular animation in this particular video, and we keep on discussing. Since being fellow YouTubers, we keep on discussing about how to go ahead and what timings to release the video and so on and so forth. But what is the commonest question that you get asked by the residents who tend to follow you? What are their queries? What is the, like a typical fan question?
Typical. It's actually very funny because the commonest comment, it's not a question, it's a comment, is, "Oh, you're so tall. We thought you were short." That's the first thing that people say when they see me in person. Because I think on video, because I'm always sitting down and talking, I don't know, it gives the impression I'm short. Everybody says, "Oh, you're so tall." That's the first thing. And the second thing, of course, some people suggest topics. "Sir, could you make a video on lymphedema management?"
Yeah.
What I tell them is, see, I can make a video. I can read up about lymphedema and make a video. But it's going to be nothing different, because it's going to be straight off from the book. Whereas what I am doing nowadays is something where I'm adding my experience to the video.
Yes.
That is what every surgeon has got an experience. And every surgeon, I remember there was a person who asked a guy, a press person who asked a guy, "What do you think about life?" So he said, Shelley has said life is this. Shakespeare has said life is this. He said, "Stop. I want to know what you think
You
about life,
think.
not what Shelley is." That way, everybody has got an experience. Tendon transfer or tendon reconstruction, everybody has done it. I have also done it. And I am not telling you just about tendon transfer or reconstruction. I am telling you what I have also learned from it, which cannot be found in books. Everybody. For instance, if Nick Hanse is saying something, makes a video about something, and he says something, it is not just in the textbook. It is his way of doing it, what he has learned over the years. So
Right.
that is an important thing that has come through. So the I cannot make a video on lymphedema, which adds on, because I have not done any surgery for lymphedema. So I can
Right.
only do topics with passion. So that passion also must be there. So we were talking about consistency. That passion also must be there. That passion to teach. That passion to get all your experience and make it into a subject and talk about it.
Yeah.
So that is also important. And the third thing, of course, is people ask me, just like you were asking, how do you make the video? Do you have a team that makes it for you?
Yes.
If I had a team for me that made it the way it has come out, no, I should fire them, because it is so badly made. It is the lighting is so poor. All that, I should have fired them. I make it myself, so I say it's all good because I've done it myself. Usually,
Yeah.
not critical of others, but when we do it, we say it's good, it's fair enough. So then I always say, see, nobody comes there to see my face. They want to see what I'm saying. So I don't want to spend too much money or resources for trying to make it look beautiful. There are a lot of youngsters who teach on Insta and all that.
Yes.
That it's perfectly made. I mean, the lighting is wonderful, the editing is slick editing, but there is not much to be learned from them. That's what,
Content-wise, they are a bit anemic.
yeah, they need a little more. And of course, some of them are concentrated on other things like a promotion or something, or telling what they do and all that. Of course, that is a different genre. That is also
Those
a,
are those are not purely academic videos like your.
academic
Those
video.
are pure teaching videos.
Yeah,
There is
correct.
no marketing involved, no promotion involved as such in it.
Yeah, so these are what I commonly come across when I interact with friends.
Right. But I think at your age, I think age is not the right word to use over here. I think I should be using the word at your
Seniority,
seniority. You
seniority.
are quite tech savvy. You tend to use PowerPoints and iPads to their optimal. You just made it clear, but just one
Yeah,
specific point. Do you use any specific apps or softwares apart from that, the free ones, the PowerPoint ones, and iMovie?
yeah. No, as I told you, I started with PowerPoints. That is, I
Yeah.
use Microsoft 365. I use a Mac, but I use PowerPoint on my Mac because I find it comfortable. I started making videos, and it's an inbuilt software for video editing. That's called iMovie. It's there in Windows. It's called Windows Movie Maker. Now,
Yes.
after a few videos, I thought there are so many apps that do video editing free. So I downloaded a few apps and started doing it, but I was not at all comfortable. I don't know, because I was biased towards my own software that was inbuilt. I just couldn't understand, or because these apps that you download, they offer so many options that you get
You don't
confused.
need them.
You don't need them, correct? You don't need them, and it takes away from your. See, I am concentrating on teaching some subject, and here it tells me, why don't you do it like this? Why don't you do it like this? No. Enough of this. I don't want all that. I'll do it the plain, simple way, and PowerPoint and Movie Maker, which comes with my thing, and sort of say, what do you have? Equipment, like for example, I have this light that I have. I don't know if you're able to see it.
Yes,
Okay.
yes, yes.
So this sort of light, that's all. This is the only thing that I have. And of course, a mic, I told you, and a green screen behind me. That's all. This is the only equipment that I have.
Equipment. Right. You are very economic content creator, I would say,
Well,
making
yes,
the best out of limited resources, like all we plastic surgeons tend to do.
yeah,
Now, sir, how do you manage your clinical work, academics, and this content creation together? I mean, before you were,
yeah.
now that you have retired, you have got, I believe, more
No,
time for yourself.
yeah, right. Now I have joined as director at SIMS Hospital, Vadapalani, which is
Okay.
the SRM Institute of Medical Sciences. And here, uh, along with me, are two very prominent people, Dr. K. Sridhar. I think
Oh,
you had him on your candid conversation also. So he
yes.
has taken me in as director of this institute.
Okay.
So, so this I've joined just about a couple of months, one month back actually, and this what I feel, Nick, is people who make medical videos or surgical videos depend on that patient load, what they are doing there. That is what is feeding them. That is what is giving the content for them to teach. If I am not going to, so I can teach with what I already have, the videos that I have and all that, but it will never be updated, and people will know, they can sense, they can smell that I'm only putting up old videos and trying to market it in a new way.
Hmm.
New cases, every single case that we see makes us think, and that thinking makes us try to understand what is the problem. As I was saying yesterday to my colleagues here, even if you do 1,000 free flaps, the 1,001th free flap will teach you a point that you did not know so far. So you keep learning, and that learning is the first step to teaching.
Yeah.
It's the other side of the coin. So this clinical work, I was telling someone that I will stop making videos when I stop clinical work. There is no point. I can't keep taking lectures.
Yeah.
I will stop making videos when I stop this clinical work, because that is the one that keeps feeding your brain and makes you think, and that is what keeps us going. People like you and me, we need that surgery, that adrenaline rush, no, to sort
Absolutely.
of work on it and teach somebody.
Yeah. Hopefully that doesn't happen for many, many years down the line. Uh, so coming to recently, you uploaded a video on artificial intelligence for burns, management of burns.
Yeah.
So that was a very insightful, interesting video. So what role do you see in our actual clinical practice for this simulation, for virtual reality, and even for artificial intelligence?
With the way that we are using artificial intelligence, so I have a suspicion that we are not using artificial intelligence to its maximum. It is going to be used much more in the coming years. But
Yes.
there is one question: is artificial intelligence going to replace human doctors in treatment? My answer would be a categoric no, because there is something there in any treatment, whether it's a treatment of a fever or whether it's a treatment of a small cut injury on the finger. There is one important thing called empathy that the computers, the machines cannot give.
Right.
CANNOT, they cannot give that. So there we tend to score over it. So as some great surgeon has said, I do not know who it is, you don't treat the disease, you treat the patient.
Yeah.
So that is most important. And that artificial intelligence cannot do. Artificial intelligence can make a diagnosis, can make a wonderful diagnosis better than you or me. And it may even do surgery. I do not know if it will come and do surgery a few years
Mhm.
down the line. But that aspect of patient doctor relationship can never be taken over by computers or machines. So artificial intelligence is something like a dog that we have trained that cannot take over. It cannot take over. It's still under our control.
Yes.
Whereas if you leave it out of control, it will take over. So it's all up to us.
It's all up to us. How do we tackle it, and how do we keep it controlled?
That's right. That's
Right.
right.
So, sir, what advice would you give to, now you have been very consistent, you have been disciplined, you have been motivated about creating this content, regularly uploading it. Now, what advice would you give to young trainees regarding how to cultivate this discipline, how to stay motivated, because I think that is also very important. Staying motivated and staying disciplined
Yeah,
for a prolonged period of time, not just a few months. You have been doing it since years together. So,
yeah.
what advice would you give to youngsters?
The only thing is discipline. No, discipline. The only thing you remember is that the patient has a family also. He or she has a family. He or she is a father or mother or sister or daughter or son or whatever. You think of that, you can never think of doing harm. And then the next thing is, I feel that about online education, everybody must come into online education. Consistency is the biggest problem. It's the biggest asset, but cultivating that consistency, as you said, is a little difficult. What I advise is, if you're starting off, make good content videos. Don't make it too long, and it must be appropriately short. Then secondly, you need to have consistency. You need to have something for yourself. That is, you say, I'm going to do it every month. For instance, just make it every month. Don't make it every week. It may be too tiring in the beginning. Make it every month. And thirdly, most important, don't expect immediate results.
Yes.
Don't expect that you're going to have 1,000 subscribers or 10,000 subscribers, or you're going to have 1 million views. It's not like that. People will watch if it is consistent, if the content is good. Only two things: it should be consistent and the content should be good. It will definitely win. If not today, definitely tomorrow or the day after, it will win. It will lose when you stop making the videos because they have not won. That's not the idea. You
Right.
keep doing it, you will win someday. I can guarantee that. But only thing is, you have to be consistent and you have to make good content, and that is the most important thing.
Right. So now you have been a teacher, now you have been an educator. By educator, I mean online content creator and educator. So, any specific life lessons that you have learned as a process of being an online content creator? Because being a YouTuber is a different genre, I would say, rather than being a regular teacher, which we are as plastic surgeons. So, any specific life lessons which you have learned, which have enriched your life per se?
How do you ask questions like this, Nikhil?
I
Yes,
just give it a thought. I
you
think about whom I am going to ask, and then I think of some difficult questions to ask.
see, actually, life lessons, if you talk about that, the most important thing is, apart from the money you get a little bit, apart from the knowledge that you gain, most important thing, I made friends. I've made friends almost all over the globe. And
Yes.
people email me, they message me, because I do not give my phone number in the videos. It
Yeah.
is only my email. A lot of people email me. uh, I feel so happy when a resident emails me saying, thank you. They always address it as Dear Dr. GK Hand Surgery, because
Mm.
that is what is given to them. So they say, they are so happy. I've just passed my exam. I've been seeing your videos. Now, what more happiness can you expect? No? So, making friends of people who you have not seen at all, that is a real sort of a boon that has been granted. So that is the biggest life lesson I've learned. If you do things with passion, if you do things with a good intention, good things always come to you. It's a very simple lesson, but everybody has always taught about this. But the thing is, uh, uh, when you talk about online education, no,
Mhm.
uh, we talk about online education. Is this good, or traditional education is that good?
Yeah.
I was just thinking about it. The biggest mentorship example I could think of is Arjun and Sri Krishna. Krishna was the mentor of Arjun when he was standing there in the middle of the Kurukshetra. He is saying, he just lays down his bow and says, I am not going to fight. Everybody is there. He's in the middle of the battlefield. And he says, Krishna, I am not going to fight. Imagine if he had said this online. He takes up a phone call. excuse me, Krishna, I'm in the middle of the battlefield. I don't want to fight now. So you know what Krishna would have said? Okay, okay, come back. That's what he would have said. But in the atmosphere of the battlefield, with all tensions raised around the place, everybody is tense, waiting for battle. This man throws down. That is when the Bhagavad Gita is born.
Yeah.
So this one-to-one, face-to-face contact, Krishna is able to see the emotions of Arjuna. He is able to sense the situation that is going on. This is exactly what happens with traditional teaching. The
Right.
student is able to see the teacher, and the student is able to follow why this teacher, why his mentor has made certain decisions.
Yes.
That cannot be learned from online education. Online education, again, is an adjunct to your traditional teaching. The same point I'm saying over and over again. It is an adjunct. Traditional teaching is what is going to take you forward. Adjunct is online teaching where you can learn something extra maybe. But your life is with traditional teaching.
Yes. Now you have been creating content regularly. Don't you feel any fatigue of any sort or burnout and waking up every day at 2 and achieving those deadlines? And
Yeah.
how do you handle that and re-energize it? What if you miss on a deadline?
Miss on a deadline. Yeah, I've always wondered about that. Touch wood, it hasn't happened so far.
Wonderful.
But it has come quite near. Sometimes I have missed that 6 o'clock. I would put it at 9 o'clock.
Acha.
It has happened once or twice. But the thing is, this fatigue, like they say, the mother who is giving birth to a child, all that pain goes away when she sees the face of her child. Similarly, I feel when we make videos and you have gone through a lot of trouble and a lot of pains to make it, and then at the next meeting you meet some students who say, "Wow, sir, we are so happy to see your videos. We've learned so much." All that pain goes away.
Yeah.
Doesn't it, Nikhil? I know you also would have felt the same.
Yeah. And it's also the process. You enjoy the process, so the fatigue levels are not there. You enjoy making it, so for whatever you are enjoying, it's fair enough to get up at 2 a.m. and do it. You are enjoying it.
Yeah, so working hard for something you don't like is stress.
Yeah.
Working hard for something you love to do is passion.
Right. I get it. Yes. So apart from YouTube now, I have been following you on Instagram as well occasionally. Not very regularly like on YouTube, but yes, your presence is more and more felt on Instagram and your Facebook.
Yeah.
So are you planning to keep, you can use the same content on different platforms, increase the audience which is being directed to YouTube as well?
Yeah, I don't know. I felt that if it is on YouTube, it must be on YouTube, because then otherwise it loses its exclusivity. So
Okay.
if I make something on Insta, it should be something different, a different genre. So you have different faces, like GK on this is teaching, on
Different,
this
yes.
is some other thing like that. So, but I don't know. I've still not understood the medium, Nikhil. I think we need to understand a medium before we go into it or try to experiment or something. Youngsters, they are all hooked on this Insta and whatnot, Twitter or whatever. And I'm trying to, as you said, I'm trying to make forays into it. It's interesting in learning that, but now, as you said, at this senior age, it takes a little time to understand this media that youngsters are so much. But see, the important thing is that we must try to understand what they want. The customer is always king. Here, our customer is the student. If the student wants you to make it on Insta, it has to be done on Insta. Because they are comfortable with that. So I need to learn a little more, maybe if I can understand it better. Maybe a few years down the line, we can all go into Insta.
Yeah. Even I feel Insta is a bit tricky, a bit difficult. Maybe because we have entered that comfort level of YouTube that you don't want to venture into some new things and some new settings and new layout formats. But I believe, yes, it is the way forward, and hoping to see more and more of your content on Instagram as well as Facebook, sir.
Thank
So
you.
it has been a very interesting and enriching conversation with you. Typically, because being a fellow YouTuber, I do tend to learn a lot of things, especially consistency from you, and that we have always been discussing whenever we meet in person. So coming to my last question, sir, what are your future plans? Are you exploring new formats? Are you exploring new collaborations? Are you exploring new ideas, collaborations nationally, internationally, so that more and more people are aware of the channel? And actually, sir, you might not know, your channel is ranked amongst the 10 or 15 top plastic surgery channels across the world, uh,
Oh, wow.
teaching channels, because I have googled it.
I
And
see. I
yeah, you
see.
however you might not have done that, so
Oh,
I thought
I
I'll
see.
let you know.
Oh, wow. Wow.
So any future specific plans about collaborations internationally?
That is the biggest problem, Nikhil. I cannot think that way at all. I told it takes me very long time to understand something. When I understand it, I go all out. But these things, this collaboration, all that, I cannot understand. I know it is important. I know it is important if I must reach out. I know a lot of people who make videos and say, I don't want people to see it. Then why the hell did you post that
Yeah,
video? Isn't it? So when you post a video, you're going to work upon it. When you
yeah,
do something, you must do it with flair and elan, and you must do it to win. Okay.
absolutely.
Yeah. So there, I learned all this on YouTube only. Where you need to key in some tag words that are so important, because when people search, for instance, if I have done something on a groin flap, if I put a video on groin flap, if some person in Africa or in the USA, he keys in groin flap, it is going to show about 100 videos on groin flap, people who have made it on groin flap. If you want your video to stay on top, you need to know what is known as SEO, that is search
Search
engine
engine
optimization.
optimization,
So
right?
there you need to get in the correct words over there, and you need to have the correct thumbnail. You should have a thumbnail, and
Yes,
they said you should have a thumbnail with your face because it's more personal. That is
yes,
what the YouTubes I have seen have told me. So they said you must have your face on it. That is why I'm advertising my face on all my YouTube thumbnails.
right,
So when you start off, you must make sure that you win. There's no point in half-heartedly going to battle. Either
right.
you go to win or say, no, I'm not going to battle, I'm going to sit at home. And whatever you do, when you make a video, you're telling the world something that you have understood. And the world wants to listen to you. It may not listen today, as I said, it may listen tomorrow or next year or even 100 years down the line, because all these are going to stay for posterity,
Posterity, yes,
isn't it? So you become sort of immortal this way. When you
exactly.
put a video, you're almost immortal. It's going to stay there. So that way, I feel that uh, people must come out and start the teaching on YouTube. But as far as collaboration is concerned, there are people who do it better, and that is why I attend a lot of conferences, because I'm hoping to get some idea.
Yes,
I need to depend on ideas from other people. I need to borrow ideas from other people and make it grow in my mind about what can be done. So that is what my I know myself. I know, GK, you're capable of this. Do this. GK, you're not capable of this. Learn it from someone.
learn it, right. So thank you, sir. It was absolutely a pleasure. I've been bothering you with the questions time and again whenever we meet in person. But this, I think, online conversation was very elaborate, very detailed, and I think we have got a lot of couple of tips and tricks for youngsters who want to venture into this field of online education, making online content, and obviously some life lessons which we have learned from your years of experience as a teacher, as a YouTuber, as a content creator, the discipline, the passion, the consistency. So thank you a lot, and lots, sir, for having this candid conversations with me. I am sure uh, many of the youngsters would be happy to hear from you for this amount of time for so long into the topic which they find it very useful. Thank you all. Thank you, sir. Thanks a lot.